Hey there, welcome to my channel. I'm excited to share with you today some important insights into teenage depression. Depression is a serious mental health condition that can affect anyone at any stage, but it's particularly common among teenagers. In fact, according to the National Institute of Mental Health, about 3.2 million adolescents aged 12 to 17 in the United States had at least one major depressive episode in 2019. That's about 13.3% of the US population in that age group. Depression can have a significant impact on a teenager's life, including academic performance, social relationships, physical health, and overall well-being. As someone who has worked as a psychologist for many years and has seen many teenagers struggling with depression, I feel it's important to raise awareness about this issue and help you identify the signs of depression in yourself or your loved ones. So let's dive in. First, let's clarify what we mean by depression. Depression is not just feeling sad or down occasionally, as everyone experiences some negative emotions from time to time. Depression is a persistent and intense feeling of sadness, hopelessness, or emptiness that lasts for weeks, months, or even years and interferes with daily functioning. It can affect a person's thoughts, feelings, behaviors, and physical health in various ways. It's a complex and multifaceted condition that requires professional diagnosis and treatment. Now let's talk about the 5 signs of depression that you should look out for in yourself or your loved ones. These signs are not always present in every case of depression, and some people may experience other symptoms as well, but these are some of the most common and noticeable signs. Number 1. Changes in mood and behavior. Depression can cause a significant shift in a person's mood and behavior. You or your loved one may feel more irritable, agitated, or easily upset than usual. You may lose interest in activities that you used to enjoy, such as hobbies, sports, or socializing. You may feel more isolated or withdrawn from others, avoiding contact with friends or family members. You may also have trouble concentrating or making decisions, as your mind may be preoccupied with negative thoughts or worries. All these changes can be signs of depression and should be taken seriously. For example, let's say you're a teenager who used to love playing basketball with your friends after school, but recently you've been skipping practice and staying in your room instead. You feel like you're not good enough at the game and nobody really cares about you anyway. You don't feel like talking to your friends or family members, and when they try to reach out to you, you snap at them or ignore them. You also struggle to focus on your schoolwork and often feel overwhelmed by even small tasks. These changes in your mood and behavior may indicate that you're experiencing depression and could benefit from professional help. Number 2. Changes in sleep patterns. Depression can also affect a person's sleep patterns. You or your loved one may have trouble falling asleep or staying asleep, or you may sleep too much or too little. You may feel tired or fatigued even after a full night's sleep, or you may have trouble getting out of the bed in the morning. You may also experience vivid or disturbing dreams, nightmares, or sleepwalking. These changes in sleep patterns can be both a cause and a consequence of depression, as the lack of restful sleep can worsen the mood and vice versa. For example, let's say that you're a parent who notices that your teenage daughter has been sleeping a lot more than usual lately, often napping after school and staying in bed on weekends. She also seems to have trouble falling asleep at night, tossing and turning for hours. When you ask her about it, she says she just feels tired all the time and doesn't want to do anything. She's lost interest in her hobbies and doesn't want to hang out with her friends anymore. These changes in sleep patterns and social behavior could be signs of depression and warrant further investigation. Number 3. Changes in appetite and weight. Depression can also affect a person's appetite and weight. You or your loved one may have a decreased or increased appetite, leading to weight loss or gain. You may crave certain foods or avoid others, or you may have a disinterest in eating altogether. These changes can also be related to changes in mood and behavior, such as food can be a source of comfort or a source of anxiety. For example, let's say you're a teenager who used to have a healthy appetite and enjoyed trying new foods, but now you feel like everything tastes bland and unappetizing. You often skip meals or snack on junk food, and you've lost weight without trying. You're worried about your appearance and feel like nobody finds you attractive. These changes in appetite and weight could be signs of depression and may require professional intervention. Number 4. Physical symptoms. Depression can also manifest in physical symptoms that may not be immediately recognized as related to mental health. You or your loved one may experience headaches, stomach aches, muscle aches, or other types of pain that cannot be attributed to a specific injury or illness. You may also have trouble sleeping, as mentioned earlier, and may feel fatigued or restless. These physical symptoms can be caused by the body's response to stress and negative emotions. For example, let's say you're a teacher who notices that one of your students often complains of headaches and stomach aches during class. The student seems to be in pain and discomfort, but there is no apparent physical cause. You also notice that the student seems withdrawn and uninterested in class activities, and their grades have been declining. These physical symptoms combined with changes in mood and behavior could be signs of depression and should be addressed with the appropriate professionals. Number 5. Suicidal thoughts or behaviors. Finally, depression can lead to suicidal thoughts or behaviors, which are the most serious and urgent signs to watch out for. You or your loved one may express feelings of hopelessness, worthlessness, or guilt that seem overwhelming and unbearable. You may talk about wanting to die or harming yourself in some way. You may also engage in risky or self-destructive behavior such as substance abuse, reckless driving, or promiscuous sex. These behaviors may be a cry for help or a way to numb the pain, but they can also have fatal consequences. For example, let's say you're a friend who receives a text message from a friend who says they can't take it anymore and are thinking about ending their life. They mention feeling worthless and alone, and you know they have been struggling with depression for some time. This is a clear indication that your friend needs immediate help and should be taken seriously. You can call a suicide prevention hotline, such as National Suicide Prevention Lifeline, and stay with your friend until help arrives. In conclusion, understanding the signs of depression in teenagers is crucial for preventing and treating this debilitating condition. If you or someone you know is experiencing any of these signs, it's important to seek professional help from a mental health provider, such as a psychologist, psychiatrist, or counselor. Depression is a treatable condition, and there is no shame in seeking help. By raising awareness and destigmatizing mental health issues, we can create a healthier and more compassionate society. Thank you for watching, and I'll see you in the next video.